Greetings everyone, Dr. Taylor Temnick here, and in today's Supplement of the Month video, I'll be discussing Designs for Health's Magnesium Chelate. In this video, we'll review the benefits of magnesium, we'll talk a little bit more about magnesium deficiency and toxicity, risks and considerations that you need to be mindful of when you're taking this supplement, as well as dosing. So, one important factor of magnesium is that it's an essential mineral found within multiple functions and systems within the body. It's actually involved in over 300 biochemical reactions. It's a component of our bone matrix, it's a muscle relaxant, it helps our nervous system and supports brain and mood health, in addition to balancing our electrolytes by transporting potassium and calcium ions throughout our cell membranes. And typically within our body at any given time, we have 25 milligrams of magnesium within our bones, our muscles, our blood, and other organ tissues. So if you recall from our Zinc Supreme video, chelation is the bonding of minerals to amino acids, which improves our availability and absorption of the supplement. For this reason, we love Designs for Health's Magnesium Chelate. With a stable chelated formula, it makes easy digestion of the 200 milligrams of magnesium found within the supplement. It's important to note that benefits of magnesium chelate vary from person to person. So you want to consult with your healthcare provider before you start adding this supplement to your regimen. Anytime that you're looking at age, you're looking at gender, you're looking at individual health needs, you really want to take this into consideration. So children, specifically 1 to 3, need 65 milligrams of magnesium. Children 4 to 8 require 110 milligrams of magnesium. And then adolescents 9 to 18 and adults over 18 require 350 milligrams of magnesium each day. So when we look at benefits of magnesium, we know obviously that it's improved absorption. So we're able to get the amount of magnesium that we need, and it doesn't cause any GI distress. We know magnesium is excellent for muscle contraction and relaxation, and it actually helps promote the relaxation of muscle cramps. We know it's excellent for bone health and supporting calcium and vitamin D in our bone's ability to create bone density. We know that it's excellent for heart health, so anyone with a cardiovascular condition or hypertension would really benefit from this because it regulates blood pressure, it regulates heart rhythm, and reduces the risk of heart disease. In addition, we know it's excellent for the nervous system. It helps reduce anxiety, it helps improve sleep quality, and overall supports your nervous system. It's also involved in energy production. So at our cell's basic level, ATP is our energy source for all our functions, and magnesium actually helps with the production of that. Magnesium additionally may help with PMS relief as well as migraine prevention, reducing the severity and the frequency of migraines. Lastly, blood sugar regulation. With magnesium's role in insulin sensitivity and blood sugar regulation, it's excellent for folks with type 2 diabetes and also for individuals who perceive stress or need additional mood support. Too much magnesium can occur. Typically, it doesn't happen that often. It's really hard to get too much from your diet, since the kidneys excrete excessive amounts of magnesium within the body. Risks and considerations to be mindful of is if you're taking a supplement of magnesium and you just started it and you notice any GI discomfort, specifically diarrhea or cramping, you want to lower that dosage and you want to talk with your provider. Additionally, know that some medications like antibiotics and diuretics will interact with magnesium's absorption. So you want to also analyze the supplements and the vitamins and minerals or the medications that you're already taking for this. Lastly, excessive magnesium, so taking too much magnesium each day. We know that that upper range is 350 and you're already getting it from diet. So if you're adding more of that through supplementation, you might have a condition called hypermagnesia that can lead to nausea, low blood pressure, or irregular heartbeat. One thing to think about specifically here in America is that according to the NIH's NHANES survey from 2013 to 2016, most Americans, about 48% of us, are not getting the dietary recommended allowance of magnesium. So that's resulting in at least a 30 to 50% less than what we were getting 20 to 30 years ago. Magnesium deficiency can be brought on by stress, excessive alcohol consumption, GI disorders, and medications. Magnesium deficiency is typically due to lack of dietary magnesium and can result in a loss of appetite. It can result in abnormal heart rhythms, worst cases, numbness and tingling, nausea, vomiting, and fatigue. If you have gastrointestinal disease such as Crohn's, celiac, or inflammatory bowel disease, these would lead to excessive diarrhea or fat malabsorption, and it would be difficult to consume to get regular dosages of magnesium. If you have type 2 diabetes, magnesium excretion can exceed itself if the sugar is too high within the kidneys. If you consume too much alcohol, you might find that it results in nutrient malabsorption and excessive symptoms of other secondary conditions, which would complicate your ability to absorb magnesium. And lastly, older adults, due to decreased rates of absorption, chronic disease, and medications, may see depletion in magnesium. So it's really beneficial to make sure that you are working with your healthcare provider, working with one of our physicians before starting your magnesium supplement routine. We highly recommend Magnesium Chelate's Designs for Health supplement because it's worked really well for a majority of our patients, and even our practitioners take this supplement as well. So if you have any further questions, please don't hesitate to reach out as always, and have a wonderful day.